Hello, and welcome to Part 2 of the Dental Expert Advisory Series. My name is Ken Harlan with Ozarks Capital Funding, and today's topic is the creation and enhancement of wealth for dental professionals. To gain more insight into these all-important concepts, I have as my guest expert Sandra Simmons, owner of Money Management Solutions. Sandra, how are you doing today?
I'm doing great, Ken. It's good to be here with you.
Well, glad to have you. Let's just get right in, Sandra. You've consulted with many dental professionals over the years. Do you think dental schools do an adequate job of training dentists in the area of money management?
No, unfortunately, money management is not taught in any school. The practice owner may get a short course on accounting, but accounting is not cash flow management or money management planning. There's a big difference between the two sectors. The only thing in actual fact that an accounting program can do for you is tell you what happened in the past. It tells you how much money came in and where it was spent. So if a practice owner is looking at how much it's cost them to make payroll and pay the bills, and that's the income target they're going after, then they're actually aiming for break even. As costs go up, they tend to start losing money. Then they just pay the bills as they get them in. So in essence, the cash flow controls the dentist rather than the dentist controlling the cash flow. On the other hand, if they're actually doing cash flow planning or money management planning, then they're setting an income planning target to do better than break even. And once the money comes in, they're planning how to best use that cash to not only pay the bills, but also to have more money stashed away in savings for emergencies and long-term wealth building. The way to do that easily and effectively isn't taught in any school, and that's why I developed the Money Management Solutions software program and training course to train the business owner how to do that for themselves and make it possible to do their cash flow planning in as little as, say, 20 to 30 minutes a week. That puts the dentist in control of the cash flow rather than their cash flow controlling them.
So what I think you're saying here is that the dentist should focus on becoming more forward-thinking rather than simply reviewing past results.
That's absolutely the most important thing that the practice owner can do. That's think and plan in futures instead of making financial decisions based on what happened in the past. You're absolutely right.
That makes a lot of sense. Well, as an expert in helping dentists optimize their cash flow, what general areas do you think these professionals could improve their operations to achieve the maximum amount of profit?
Typically, budgeting is the biggest area because the practice owner has to know exactly how much cash flow they need each week to do better than break even. And they have to factor in not only the increase in the cost of doing business each year, but also the money that they're going to need for handling emergencies, expanding their practice, and for their own long-term retirement plan. And I call that the income planning target. As you know, the first thing my software program does is quickly show them exactly how much money they're going to need to bring in each week to meet that income planning target. And only then can they really figure out how many patients each dentist and hygienist needs to see each week to meet the target. And then once the cash comes in, we use the money management system to make those targets, patient targets, happen through promotion and also by portioning out the income that they did get in to pay bills, pay off debt, expand the practice, and setting aside what we love to call buckets of cash for the practice owner's long-term wealth building program. And it's a very simple but very powerful process.
Well, let's just say that the incoming cash doesn't quite meet the targets they've set. Does the program help allocate the deficit to the various outflows?
Well, the program helps the practice owner decide how to do that without cutting back in areas that would harm production. Money is always allocated for things that will increase income, for example, promotion. But the planning program is a process for the individual practice. It's definitely not a one allocation formula fits all program. So the practice owner is going to have to make some decisions for their particular practice.